Hi guys. So as you can see, we are trying things a little differently today. On the last survey, several people suggested that they would like to see me while we had this lesson. And so I thought I would try this with the webcam so you can see me talking to you, see how you like it. It's just a test to see what works best for everyone. I would love one day to be able to do a lesson that was videoed with me at the whiteboard or doing a PowerPoint on a flat screen TV or something like that. But I'm just not set up to be able to do that. You really need good lights and a good room to do that and everything. So this is probably the best that it gets right now, unless other people have other suggestions of how you would like me to take these lessons to video, or how you would like to see me on video while doing the lessons. The other thing that you will notice that is different is the slide deck. I'm trying a few different templates is the word I'm looking for. A few different templates to just kind of see which ones you guys like and which ones you think that I should use. So I'll ask you about that in the survey as well. So today we're going to talk about the symptoms of gluten sensitivity. I'm hoping it'll be a pretty quick lesson for you, but I think it's a really important lesson because there are a lot of symptoms of gluten sensitivity that people would never guess that gluten could cause. And some of those symptoms may be things that you are experiencing. And so I wanted to really go through a good list of things that you can figure out if they might apply to you. Gluten can affect every organ in the body, and you will see that as we go through this lesson today. There are actually over 350 documented symptoms from celiac disease or gluten sensitivity. And the good news is that the list we're going over today is not all 350 of those symptoms. So we are not going to be here for an hour talking about the possible symptoms of gluten. But we are going to cover the majority of the most common symptoms. One thing that I really want to emphasize before we start is that you may not even know that you have these symptoms. Even after we go through them, I may say something and you may think, I don't have any problem with that. That is what I thought about several things before I went gluten-free and discovered that a lot of things that were going on with me that I just considered a normal part of being a human being actually weren't normal. One of those things, just to give you an example, was bloating. I had bloating, but I thought that was just normal for human beings, that after they ate, they got bloated, and that it was normal for your weight to fluctuate a lot during the day. I used to wake up, and by the time I went to bed, I'd gained 3 to 5 pounds in that day, and the next morning it would be gone, and repeat the cycle every day. And I honestly just thought that that's what people did. I know now that that's not what people do normally, but I really thought that that was normal. I've talked to people who have had diarrhea their whole life and had no idea that they had diarrhea because they'd had it their whole life. And so they thought that that was what a normal bowel movement was supposed to be. It's very much like someone that's gotten glasses for the first time, and they put their glasses on and they look across the street and they realize that all of this time they were supposed to be able to see the leaves on the tree, and they were only seeing the tree and this green stuff on it. But they put the glasses on and they look and they see, oh my gosh, there, I can actually see the individual leaves, and they never knew prior to getting glasses that they were even supposed to be able to do that. The first group of symptoms, I tried my best to group these into the different systems. It worked pretty well to do that, but it's not a perfect system. Gastrointestinal symptoms, I want you to realize that people with gluten sensitivity do not always have gastrointestinal symptoms. It is very, very common for people with celiac disease to have gastrointestinal symptoms because they have that that damage to the bowel that we talked about in the last lesson. But people with gluten sensitivity, sometimes the inflammation that occurs in the bowel isn't really enough to cause gastrointestinal symptoms, but it is enough to cause leaky gut and for the inflammation to get all through the body and cause symptoms in other places. So it's very important to realize that if you don't have gastrointestinal symptoms, that doesn't mean that you don't have a gluten sensitivity. And that was one of the mistakes I made, because remember, I didn't realize that I was bloated, so I didn't think I had any kind of gastrointestinal symptoms. And I kept telling my friend that was suggesting that maybe my problems were related to gluten. I kept telling her that I didn't have problems with gluten because I didn't have stomach problems, because that's what I had learned in medical school, and that's probably what your doctor learned in medical school. We are taught that the only type of gluten sensitivity is celiac disease, and all people that have celiac disease, or most people that have celiac disease, have gastrointestinal symptoms. We are not taught about non-celiac gluten sensitivity in medical school. And so in my mind, since I didn't have gastrointestinal symptoms, I couldn't have gluten sensitivity. And I obviously was very, very wrong about that. So you can have diarrhea, constipation, bloating, gas, abdominal pain, steatorrhea, which is this pale, foul-smelling stool that it comes from not absorbing the nutrients that you eat. Vomiting, very, very common, especially in children that are gluten sensitivity or have celiac disease, but we can see it in adults too. Reflux and heartburn. Lactose intolerance. This is another one that I had that I never would have thought was related to gluten for as long as I could remember, since like high school. Anytime I would eat ice cream or have any kind of milk product, it would give me really bad stomach cramps, and I'd have to run to the restroom within 10 or 15 minutes of eating it. And once I went gluten-free, that problem with lactose went away 100%. Irritable bowel disease is also called irritable bowel syndrome, or IBS. And this is a label that is given to people that go to their doctor with diarrhea, constipation, and abdominal pain, bloating, gas, and their doctor does tests and can't find anything at all wrong with this person. And remember, we only know, or most of our doctors are only looking for celiac disease, and because non-celiac gluten sensitivity isn't on their radar. And so these patients are told that they have this illness called irritable bowel syndrome, which is essentially just a name for all of these symptoms with no cause. But it turns out that most of these people, if they get gluten out of their diet, they will get better. And then inflammatory bowel disease is a set of autoimmune diseases that affect the bowel. Gastrointestinal symptoms and the damage that's done to the gut can also cause nutritional deficiencies. Iron and folate deficiencies can manifest as anemia. So if you've been anemic and your doctor couldn't figure out why, then it's very possible that it's gluten sensitivity. Calcium, vitamin B12, and then all of the fat-soluble vitamins, A, D, E, and K, all of those we can see deficiencies in with gluten sensitivity. Neurological symptoms, chronic headaches, extremely common to go away once gluten is out of the diet. Migraines, seizures, and yes, I could, if I didn't know better, I wouldn't believe that gluten can cause seizures. Such a tiny little particle can cause that kind of irritation in the brain to cause seizures, and it's crazy that it can do that. Ataxia is a jerky, uncoordinated movement. Peripheral neuropathy is this numbness of the tingling in hands and feet that feels like a pins and needles sensation, or like your hands or feet are asleep. And then poor memory and brain fog are very, 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 very common with gluten sensitivity. And people that have noticed that their memory isn't as good, or they just feel confused, or like they can't focus very well, that those things clear once gluten is gone. Mental health symptoms, depression, anxiety, moodiness. Lord, I'd get extremely moody within a half hour of eating gluten. Anger and ADHD. It's very something I very commonly hear from moms that have had ADHD kids that they've taken off of gluten, and a lot of these moms also take them off of dairy, and they see an incredible improvement in their ADHD, and a lot of these kids have been able to get off medication that way. Hormonal symptoms, PMS, something called PMDD, premenstrual dysphoric disorder, which is PMS on steroids. Hormone imbalance, infertility. I can't tell you how many stories I've heard of people being infertile until they went gluten-free, and then being very easily able to get pregnant after that. Hot flashes, menstrual irregularities, delayed puberty, and even miscarriages can be caused from a gluten sensitivity or from celiac disease. Autoimmune symptoms. We can see Hashimoto's thyroiditis, which is where your immune system attacks your thyroid and causes your thyroid hormone to be low. Graves' disease is the opposite of that. The immune system attacks the thyroid and causes too much thyroid hormone and to be secreted. Lupus, rheumatoid arthritis, endometriosis, juvenile diabetes, multiple sclerosis, psoriasis, eosinophilic esophagitis, and 150 other autoimmune conditions can be attributed to gluten sensitivity or can be made worse by gluten sensitivity. And when these people with these autoimmune disorders get gluten out of their diet, they see great improvement in terms of not having as many episodes related to their autoimmune condition, and in some cases with the autoimmune condition going away entirely. We can see bone and joint symptoms, fibromyalgia, very, very commonly related to gluten. Arthritis. For those of you that may not know what fibromyalgia is, although it's commonly known these days, it's where it's fatigue and pain, tender muscles and joints, and a lot of fatigue. Arthritis, joint pain, bone pain, muscle pain, or tenderness. Joint pain is probably one of the top 5 symptoms with gluten sensitivity. Skin and teeth symptoms, recurrent canker sores or mouth ulcers, loss of hair or thinning of the hair, bone loss, eczema, psoriasis, this rash that's related to celiac disease called dermatitis herpetiformis, discolored teeth, and enamel loss. And some of these symptoms from gluten sensitivity, some of them are related to the inflammation we've talked about, and some of them are related to the nutritional deficiencies that we've talked about. Growth and weight symptoms, we can see weight gain definitely with gluten sensitivity, and we can see a lot of people lose weight once they get gluten out of their diet, as long as they're not replacing the junk food, gluten foods with junk food, gluten-free foods. Weight loss is common for those people who have enough bowel damage that they're not absorbing enough nutrients. Muscle wasting, short stature, developmental delay, poor growth or underweight. All of these things relate to not getting in enough nutrients whenever your bowel is inflamed from the gluten sensitivity. If you have a child that's underweight, your pediatrician will probably test for celiac disease, and some of them will even test for gluten sensitivity. But I want you to realize that those tests can be wrong if they're negative. If they're positive, they're great. But if they're negative, they can a lot of times be wrong, and your child can still be gluten sensitive. So it's very important to take them off gluten for a period of time to see if they start growing better. Energy, chronic fatigue syndrome, thyroid problems that aren't related to the autoimmune issues, fatigue and exhaustion. I definitely had exhaustion, not just fatigue, absolute exhaustion before I went gluten-free. There were points in time that I would be doing something and such a severe heaviness would come over me. It was like someone drugged me all of a sudden with sleeping pills, and I had to stop whatever I was doing and just go lay down and go to sleep, because I had absolutely no control over that sudden exhaustion, and that went away completely once the gluten was out of my diet. So, takeaways from this lesson. I want you to download the gluten sensitivity symptom checklist that came with this lesson, and I want you to rank your symptoms in severity. I didn't leave a space on the handout for you to rank it, but just write it out by the side. 0 if you have no problems, and 10 if you have severe problems with that particular symptom. And then keep this list for future reference so you can look back and see what kind of progress you've made once you've got gluten out of your diet. Thank y'all so much. I really, really, really appreciate you being here. And I really just thank you. And I hope this is helpful for you. And again, I will send out a survey in a day or two to get your feedback on this lesson. I appreciate y'all so much. Thanks. Oh, I forgot to say, testing for gluten sensitivity next next lesson. What I wanted to tell you guys about this is that if you really want to get tested, then and you don't want to wait for this lesson, and you know you want to get tested no matter what I say about it in the next lesson, and you've just been dying for me to do this lesson because of that, just message me and I'll send you the link that you need to get the testing done, okay? Don't hesitate to do that. But if you want to hear what I have to say about it before you decide if you're going to do any testing, then I hopefully will have that lesson out in the next week.